The Community Health Center has many programs in the Summit County area. We are primarily a substance abuse treatment program that we provide individual and group counseling services to both adolescents and adults. We also work with anyone who has a chemical dependency problem. So this could be a person who's abusing alcohol, or it could be a person who's abusing heroin. So we go anywhere from alcohol, marijuana, to cocaine, to amphetamines, to opiate drugs. The Community Health Center works with many individuals from many walks of life. We have people who have walked up from the Haven Arrest and are homeless seeking residential treatment services or substance abuse treatment services. On the other hand, we have physicians who are seeking treatment, nurses who are seeking treatment. We have people from all walks of lives, from all of the communities of Akron, whether you're homeless living in Akron underneath a bridge, or if you're living in Hudson or Green or Silver Lake. We have seen clients from every area of town. Clients enter our agency through many different ways. It could be an individual who was seeking treatment services on their own, and they would just simply call us. When we take a call from an individual, we're going to be asking them, how can we help you? What problems, what concerns are you having in your life? If we can provide them treatment services, then we get general information from them, name, address, and we schedule them an appointment. The other way that clients are referred to us is a lot of people are mandated into treatment, or that they're referred to treatment by outside referral sources. With adolescents, it could be a school that they had an incident at school regarding alcohol or drugs, and that they're asked to either have an assessment or to have an intake interview to start counseling services. The intake department provides a service called Chemical Dependency Assessment. It is a written report which is sent to a referral source regarding the person's chemical dependency. So we are making a judgment as to whether or not a person has a chemical dependency problem and if they need treatment. When a person finishes their assessment or their intake interview, what we're going to be doing is assigning them to a level of care. Level of care can be individual counseling, intensive outpatient, residential services, or methadone treatment services. Any person who comes in for counseling services goes through a financial intake interview, even before the intake worker sees them for their interview. We base our fees on a sliding fee scale for residents of Summit County. We also accept Medicaid and Medicare to pay for treatment services. And if an individual has insurance, then we will always try to work with that insurance company in order to bill the insurance company instead of themselves. We get many phone calls from individuals who are concerned about a family member who are adults regarding their substance abuse issues. In this situation, we will talk with the person briefly to try to determine whether or not we are the most appropriate treatment center for them. We may refer them to a detoxification center if we feel that the person needs to be detoxified from like alcohol. If we feel that we can work with the person, we strongly encourage that family member to have the client call us. I know myself, I will give them my name, my individual phone number, so that they know that when the person calls, they're talking to a person who already knows their story. When a client calls the agency for treatment services, what they're going to find is, fortunately for us, is that we can usually see them within a week's time. If we're working with a pregnant woman, that is a priority for us, and we try to see them within 1 to 2 days of the phone call. Most individuals are seen for approximately within 1 week of the appointment time. One of the things that we have just started doing, though, is that we do have a walk-in program for people who chronically miss their appointments. So if a person doesn't make it in for their appointment, they may be referred to the Friday morning walk-in program, which is first come, first served for individuals.